They're known as biomarkers, and their importance in the fight against lung cancer has come front and center. With us to discuss the multidisciplinary approach of biomarker testing is Dr. Gary Palmer and Dr. Deborah Morosini, both from Foundation Medicine, based in Cambridge, Massachusetts, a molecular information company utilizing next-generation sequencing. Good morning, Dr.
Hi,
Palmer.
Olga. How are you?
Good morning,
Good morning,
Dr. Morosini.
Olga. Great to see you.
I'm really thrilled you're here today because this topic for me is extremely interesting. We've come a long way. My best friend, she actually works with a company that does biomarker testing, and she's always talking to me about it. So, Dr. Palmer, let me start with you. Tell me, and please keep it simple, what are biomarkers and biomarker testing?
We're undergoing a great revolution now in our understanding of cancer.
Yes.
And simply put, what a biomarker is a marker of a particular cancer. And we know now that no two cancers are the same.
Correct.
That cancers have individual changes in the DNA, changes in their genetic makeup, if you will, that make them individual.
Which is giving so many people hope out there. Now, why do they matter, let's say, in lung cancer specifically?
Well, lung cancer is really, in many ways, the poster child. We understand these changes, these markers, if you will, in lung cancer more than in any other kind of cancer. And what that means is there are more therapies directed against these individual markers in lung cancer than any other kind of cancer currently.
Dr. Morosini, let me bring you in. Tell me the significance of the multidisciplinary approach when it comes to biomarker testing.
Sure. So about 65% of patients who are diagnosed with lung cancer currently are diagnosed at a later stage, a stage 4. It's an asymptomatic disease. There's not a widespread screening program, unlike breast cancer or colon cancer. And so patients really are passed from physician to clinician to different specialties until they arrive at their oncologist. And it's important that a patient get these biomarker tests early, right upon diagnosis, so that by the time they arrive at their oncologist, the oncologist is able to understand what is in this tumor, what's the genomic profile, what does it bear that can be drugged. So you're really looking for these targets.
Which is kind of like what we've seen with breast cancer, because
Yep.
in other words, we've come a long way when it comes to that.
Yeah, I'm a
Yes.
breast cancer oncologist by training, and we've known about markers in breast cancer since 1998.
Oh, wow.
And it's only more recently that the importance of these markers, of these changes, are becoming known in other kinds of cancer. So hopefully the day will come when every lung cancer patient will have the genomic profiling to show these markers, much as it's done in breast cancer routinely now.
So I guess, Dr. Palmer, it would be okay to assume that the diagnosis and treatment when it comes to lung cancer has really evolved.
It really has. We're seeing, analogy I could use is a rocket ship increase, you know, a takeoff in the number of therapies that are available now.
But even doctors, whether they're oncologists or even internal medicine, whoever it is, it has to be a team effort of all these people ordering the biomarker testing. Is that correct, Doctor?
Right, making sure that this is done and raising that level of awareness. And of course it's done, you know, if you're on one of the coasts, it's routine care in an academic medical center, but our goal is really to have this in all community practices, anywhere someone goes where it's really well understood that ordering a biomarker test or a genomic profile for lung cancer.
Dr. Palmer, I know this because I have a friend of mine who passed on from lung cancer, and as soon as you hear that, the first thing you think of is, I'm imminent. So this could be such a game changer.
And that's what it's really all about. It isn't just to understand the cancer in a scientific way, it's to allow treatment options to be available to the patient. That's the key.
Okay, I want you to stay right there because we have more to talk about. So when we return, we're going to learn more about biomarker testing. We'll also include a very personal story from Dr. Morosini. It's one that you and I know very well, and it's a wonderful story you're going to want to hear. So stay tuned. The Balancing Act continues in just a moment. We are once again talking with Dr. Gary Palmer, an oncologist, and Dr. Deborah Morosini, a patient advocate, both from Foundation Medicine. Dr. Morosini, I want to bring in now a personal story. You have become a patient advocate since the death of your sister, who was married to actor Christopher Reeve, better known as Superman.
Yes, so Dana was diagnosed with lung cancer about 9 months after Chris died. And they had been advocates for spinal cord research. And when my sister was diagnosed and died from lung cancer very soon afterwards, I was moved to patient advocacy to raise awareness about this disease.
And she wasn't even a smoker, if I remember correctly.
No, and so that shocked me as well, and I'm a trained pathologist and I'm an MD, but this is really not an anomaly. There's an epidemic in young women, non-smokers, being diagnosed with lung cancer, and Dana was really typified that.
Doctor, let's go back to that biomarker testing. Talk to me about the test and what it entails.
Sure. There are several tests available. The test that we do is generally ordered by the oncologist, and the pathologist will then send in the tissue, the cancer tissue in which the test is done. It takes about 2 weeks to get the results.
Okay.
And the good news is we can do the test on very small amounts of tissue. So even the small little needle biopsies that are often done now, there's plenty of tissue, generally speaking, to do the test.
And wouldn't this test be done regularly by a pathologist?
Well, we hope more and more.
Okay.
I think one of the messages is that with the increasing number of targets that we can find, and more importantly, the increasing number of therapies that you can use, this testing should be more and more of a routine once a cancer diagnosis is made.
Well, and I've seen the landscape change enormously. It's given me huge amounts of heart and hope in the last 8 years to see how far this field has come and that it's really accelerated rapidly, and that's been my hope.
This has been great information, and thank you so much for sharing your sister's story. Dr. Palmer, I want to end with you. Any closing thoughts for people out there?
Sure. We're really seeing a revolution in the way cancer is being treated now with the increased number of targets and targeted therapies. So I would encourage patients and patient advocates to talk about testing.
Thank you so much for your time and for all the great information you've shared with us
Olga.
today.
Thank
and
you.
please come back with any updates you have.
Absolutely.
Appreciate
Enjoyed
it.
being here.
And for more information on health-related topics, visit us at thebalancingact.com or let us hear from you. Log on to Facebook /The Balancing Act fan.